Welcome. Thanks for coming out to our transportation assistance info session, which is being put on by Nashua Regional
Planning Commission
Thank you. Sorry.
and Mobility Management, the RCC,
Yeah.
the Regional.
Great. Thank you. Sorry, I got lost in the acronym.
Yeah, it's okay. That's okay. No problem.
So yeah, thank you for coming out here, or if you're watching on the internet, thanks for stopping in. Just a couple of quick things before we get started. In the unlikely event that we need to evacuate the building, the closest exit's right over there. It's just out onto the porch, down a couple of stairs. The other exit would be the way you came in. The bathroom is located at the bottom of the stairs, around to the left there, the way most of you came in, opposite that door. I think that's pretty much all the building stuff I need to go over. And yeah, if you're interested in any other events that we've got coming up, in about 3 weeks, we're doing a screening of a PBS indie lens or independent lens documentary called Free for All, the Public Library. It covers the history of libraries in this country, how they got started, the effort to make them available so that we have them in many, if not most, communities in the country now. The challenges they faced since then. We'll have a little discussion afterwards. Should be fun. So yeah, that'll be on June 5th, which is Thursday afternoon? Yeah. So if you're interested in that, we'd love to see you for that as well. And we've got our summer reading program coming up. We do weekly events for adults, teens, and kiddos. We're having a comedian come in one night who does stand up for sort of an adult, slightly older crowd, Ben, not like exclusively, but we're having a talk on coyotes, which I know we had some issues with coyotes in the area not too long ago. So hopefully the presenter there will be able to shed some light on good ways to coexist with the coyotes that live here. And all that stuff is, it's coming out. Okay. Yeah, so we've got a lot of exciting things coming this summer. We're going to be pushing out all the calendar stuff about that in a couple of weeks now. So keep an eye out for that. And I think that's all my updates. So I'll hand it over to Donna.
Good. Thank you, Ben. Come on in, Janet. Hey, come on in. I was hoping you'd be here. So that's great. I'm Donna Marceau. I'm the Regional Mobility Manager for the RCC7, which is the Regional Coordination Council. And we'll get into a little bit later what that means. But I work at the Nashua Regional Planning Commission. And what they do is they provide various services to towns, the 13 municipalities within our region. And so there's certain things like planning assistance, mapping assistance, transportation project. If a big transportation project goes in or the town wants to do something, they come to us and we help them with all the plans they need to get that going. We also help with hazardous mitigation. So if you have waste, every now and then you'll probably see that there's waste times when people can dispose of waste. And I can get you that. And it's also on our website. At the different times you could go to dispose of hazardous waste so it doesn't get into the landfill as well. Also energy savings, we work on that for municipalities. We also work on regional issues such as economic development, the environment, and today we're going to talk about mobility management. So we'll just go to the next slide.
Sure.
Good, thanks.
Let me just share real quick All right.
Good to see you. I was hoping you guys could do this. Good.
All right.
Okay.
There you go.
So this is the services.
Whoa.
Just
Sorry
for 1 minute, and
Yeah.
so you can know my contact information. And what I do is I try to help people get rides. So if you need a ride somewhere, I can try to help you get that ride, or if somebody you know needs a ride, it's all in the back of the flyer. We'll go over the folder in a while, but I just want to let you know who I am, Donna Marceau, and that's where I work. That's my information, which is in the back of the flyer. And if you do need a ride assistance, please contact me, because you think you're not going to need this. This happens so many times. People say, I didn't think I needed it. And then they call me up. I broke my leg. I can't get here. I can't get there. So it does happen. So since we've started, we've had over 600 calls for help. So we've actually have like a robust system going, various people calling, and tell your friends too, your family members as well. Sometimes family members will call for a parent to try to get the transportation for the parent. So the word's getting out there, and social workers will call me, nurses will call me to try to get services. So that's my information. It's on the brochure. So now we'll go into a little bit into mobility management. So we'll talk a little bit about mobility management, and this is Janet Landau. She's the chair of the Regional Coordination Council, and she was at the forefront of establishing this in the region as well as statewide. So what exactly is mobility management? So we'll talk about that now. So it's a
Okay, fine.
yeah, go ahead. So it's all about, most important thing, it's about people. So we're trying to connect people. We're trying to connect people transportation wise. Mostly the calls are for medical appointments, but they can be for other things too. So you say if you don't have food, you can't get to the store, we can help you with that. And we partner with agencies such as United Way, Meals on Wheels to try to get people what they need. So those are the primary calls that we get, a medical and for food. But we also get calls for things such as younger people will call me about work. Some people call me about bus passes. People call me various things. So it's a whole service of different services we have. We have a partnership with very many agencies, and we try to get people what they need. If they call me about anything, I try to connect them with somebody. But really transportation, that's the real need. And we know it's going to be a need because we know that more and more people are needing this. So if we see the demographics, so,
Oh, sorry.
okay, so yeah, that's okay. So what are the challenges here? So we just go back to the one before, because what are the challenges here? Maybe some people here can tell me what the challenges are for people. Go ahead.
Well, if you live in Litchfield, you're pretty remote from the bus
Right.
line, and I don't think the taxis like to come here. I think they add a surcharge, if I'm not mistaken.
Oh, okay, all right.
So it's,
okay.
it's hard to get places from here unless you have your own car.
Right, exactly. So we're not, we do have some services, but we're not public transportation heavy here in this, the whole state isn't really public transportation heavy. We're trying to do better, and we're really trying to close the gaps, and that's what mobility management is trying to do. We're trying to close the gaps, but there are problems. Let me just go back to the other one, just so they can.
This one?
Yes, that's good, okay. So, so it's medical transportation. We've had people go to Lebanon from our program. We have, people that, go ahead. Oh, okay. So, and we're also trying to work on, long distance to Boston. So that's one of our, side projects that we're working on to try to get that, because we did do a survey, and it's about, 20,000 people from this region going to Massachusetts for medical services. So we are trying to work on that as much as we can. We have some solutions kind of in the works, but it's not definite yet, but it is one of our side projects. And then there's a need for more workforce transportation in the state, because people need to get to jobs, and sometimes people might get a job, but they don't have the transportation there. So that's really can be a problem for people. So,
And with the medical transportation, this area, almost every hospital has changed its affiliation to another hospital. So if you go to St. Joe's and you need heart surgery, you go down to Massachusetts to Leahy Clinic. If you go to Southern in in Nashua, you go down to Mass General. And then if Lowell just affiliated with Tufts. So they're not doing any major to us in this region. So a lot of our medical care is being sent out of state.
right,
See, and
exactly.
it's interesting because the challenge was when we started all of this back in the early 2000s or whatever. You still had St. Joe's, Memorials, pardon me,
Yeah.
Southern,
Yeah,
Elliott, CMC, and then CMC and Elliott kind of joined together. Okay, that's fine, that's all Manchester. But then we start the cross, solution which
Yeah.
now will no longer be.
Yeah.
And then the affiliation with Leahy.
Yeah.
You know, originally, and when you have access to public transportation in a more urban area or an area where maybe there's paratransit service, you can make those connections, but to get out of it, to get to Burlington, you know, to get to Lebanon, if you had to, if you were a Dartmouth Hitchcock person. That's the big challenge, and that's, you know, one of the things that we've been focusing on. But you're absolutely right, and I can only expect that we're gonna see more of this now with the shifting that's happening between the five major providers in our area. And between Manchester and Nashua. I mean, how many of you in this room seek most of your medical care in Nashua? Okay, how many are Manchester? How many are Massachusetts? That is interesting. That really is interesting.
See, when I moved up here, I kept my.
Yeah.
Doctors.
Sure,
Yeah.
sure.
Yeah.
Yeah. Thank you very much for bringing that point up. That's a
Well,
good one.
that was obvious when we had people in the community that started getting, you know, daily radiation for cancer. You know, daily or weekly chemo or immunotherapy. You know, and then I remember I'm a retired nurse practitioner, but I did pediatrics, so this senior healthcare stuff is bizarre to me. When I was at the doctor's yesterday and I did pediatric heart surgery and transplants, I said, she's talking about my heart, and I said, I don't understand that language, my kids never had any of this stuff. But you go where you're gonna be taken care of, but they are changing affiliations every time you turn around.
Yeah,
So you can be taking, I mean, I've had 3 primary care physicians in 10 years out of the same office.
yeah,
Same
yeah,
office,
yeah.
3 different doctors, so getting people there. And then knowing that the changes are gonna happen, you have someone you can depend on to get you back to where you need to go.
And there are some things that are, if you're choosing to go to Boston or choosing to go to Massachusetts for a specialty service, is one dynamic. But if you're going for your primary care, that's a whole different dynamic. And has other ramifications. So yeah, I get that. That's great. Yeah, I'm actually glad I was in gerontology and discharge planning when I was in nursing.
Right.
Yeah.
So good, so for the Massachusetts people, if you'd like, I do have a survey because we're trying to kind of figure out what works for people. So if you, at the end, if you could take this little survey, we'll just keep it anonymous. But we do have a survey because we're trying to find out what's gonna work as far as getting the transportation there, if anything, so. So also too, there's a big need for volunteer drivers. If you're still driving and you could drive somebody else, I'll explain this a little bit later as well. A need for volunteers, people to volunteer drive. There's a program, Caregivers from Catholic Charities, and they have a big need for volunteer drivers. So if you have any time, or if you know anybody that kind of has the time and is willing to do that volunteer driving, it's really needed. So, but we'll talk about that a little bit later. So, so good, thanks. Thanks, Alex. Okay, so and we're seeing the demographic. It's a fast growing demographic. The state knows it, people know it, and something has to kind of happen for people because if there's like an imbalance there, you really have to gear up the transportation, especially to medical appointments. So it's known, it's a fast growing demographic, and we're trying to do, the state's trying to do what they can to try to help people get around. So, so then, and then this is really specific funding that we get from the federal government, and it's really for seniors, for disabled, low-income people and veterans. So that's the funding source, is basically. So, so that's where this all comes from, is the federal government gives grants.
Well,
through the
right
state.
now,
Yeah,
I don't know about what tomorrow's gonna bring.
do you have any idea how secure that funding is or how long you're committed to fund your program?
The reports that are coming from our colleagues who are intimately involved in Washington, other than our senators and that. So far, we've been fine, but the FTA is now coming into the sites for federal government. And we know that a number of the FT, that's the Federal Transportation Administration, where the funding for transportation comes through. We know that their staffing has been reduced. We've seen cuts regionally at the regional office. They've yet to start clawing back, if you will, on federal dollars that have gone towards transportation projects, whether it be transportation like buses and ride services or roads and bridges. But again, we're early in the 4 years, so.
Right.
And that's no disrespect to anyone. I mean, that's just, that's what they're
That's what's
looking
going
at.
on, we have to look at it. It's
Yeah.
not-
I have one more quick question.
Yeah, go ahead.
Is there any state money coming into the program?
The state of New Hampshire has traditionally been one of the lowest per
I
capita
love that, yeah.
contributors. And unfortunately, I don't have the stats at my fingertips.
But you don't know.
They, last year, the last 2-year budget, they actually put in some additional funding that was benefiting our public transportation systems. So Coast, MTA, Manchester Transit Association, our Manchester Transit Authority, Nashua Transit System. This year, additional monies were asked for and they were jumbled around the budget. Leadership went to the two finance divisions at the House. They think they may have a way to get some funding,
It hasn't passed yet, so.
but it hasn't passed yet.
Curious as
So
to
we
what
don't
it
know.
was like now. Yeah, thank you.
Yeah, I mean, they're looking for like 1.7 million.
Drop in the bucket.
But a drop in the bucket that will help.
Okay.
When you're coming from very little to nothing to something.
Yes, exactly.
Right, every penny counts and we try to utilize it all very well. So,
Thank you.
but thank you for the questions. Go ahead. Okay, so this is,
Oh, sorry.
that's okay, don't worry about it, it's okay.
Yeah.
So this is the map of the whole district. You can see the whole map of the whole district. So you can see here that we have Nashua here, and that's the area that most people, concentration of people without vehicles is in Nashua. And there's some of a little bit of concentration, Pelham, Milford and Wilton. And then this is Litchfield right here, where it seems like most people have a vehicle here. So, but that's how you can see the whole district, from Pelham all the way to Mason, Wilton and Leidenborough. That's it, but you could see that it's mostly in downtown Nashua is where people don't have vehicles. 'Cause-
And I think what reflects that too, is I was telling people how many moved out of our little community this year. Because they're either alone and they don't drive anymore, and there isn't anything but their neighbors to take care of them, so. People may be able to stay longer in their own home here. If we had some kind of transportation
Yeah,
help.
exactly. Right, exactly.
Then they'd be a house without a car, but
Right.
they would have transportation.
Right, they would know something, so. So that's basically the map in where people are as far as the vehicle concentrations, so. Okay, so this isn't just me standing here and Janet sitting there. There's a whole state coordinating council for community transportation. And so it was established in 2007. And people knew that there were mobility and access challenges for senior citizens as well as disabled and low-income people. So this is a coordinating council. So we try to work together. There's various entities from the state as well as different agencies that meet in this. I think it's one back. So these are all the regions, and our region is right here, the green. That's the Greater Nashua Regional Coordination Council right here, and then these are all the other regions you see here. So all the bottom ones all have mobility managers, and the Region 1 and Region 2 don't at this point, but hopefully they'll get one soon. But we all
They
try to.
did have one.
Yeah.
Right?
Yeah,
They did-
yeah,
they
they
did
did,
have
yeah,
one.
they had one in each region,
But they're restaffing it. This
yeah, and people, some people seem to move on sometimes. Was that?
That's a lot of area.
Oh,
That was the
That
challenge.
is, right,
That was the
isn't that?
challenge.
Yeah, it's a lot of area to cover, exactly, but we all work together really well, we all get along, and if somebody has a question about this, we send it to the other person, so even if somebody needs to get somewhere, we try to help them along by, contacting our, other mobility managers in the region, so those are the regional coordination councils. So then this is our council, it's RCC 7, and Janice is the chair. And the purpose is to engage our region and to really coordinate transportation programs and to try to get as many community partners. And you're all welcome to come to the meetings. I'll actually just pass out the flyer that you could have this, and if you can remember to, maybe you could come together and.
And
Zoom
there
in.
are, there's an option to join us by Zoom as well.
Yeah, you can zoom in as well too. So, but you're all welcome, and we have interesting discussions. So, and we always have refreshments, so, it would be great if people could attend. We try to get as many people as we can there. So that's really our goal in the council, and we try to get information out to people too about various things too that are going on. So that's the meeting notice, that's our symbol. It's okay, so that's our symbol, and so the meeting's the fourth Thursday of the month, so the next meeting is next Thursday. It's at 10 o'clock, it's at the Nashua Regional Planning Commission on the 3rd floor. So, so you're definitely welcome, we have refreshments, and we're really getting to be a good cohesive group. So, so you're all welcome, and tell people to post it wherever you are, so people know about it. Because sometimes people might have a problem getting places, and we're trying to work on these issues. So, good, thanks. Okay, so this is the Mobility Manager Network. I just told you a little bit about it here. And so we're all connected. We really get along well. A lot of us are right in there, and those are some of the people from the SEC. So October is Community Transportation Month. So this past October, we all met, and those are all buses from the various systems around the state. So this is Coast. This is NTS, that's MTA, and that's Central New Hampshire. So those are the bus, yeah, Concord, right, the central part of the state, right there. So that's basically some of the group, not everybody's there, but that's really the group, and we try to work together for your benefit, for the benefit of the citizens. So good. Okay, so this is the network, and it's the SEC, which we talked about a little bit, also New Hampshire Department of Transportation, and then there's the statewide mobility manager, and here's the regional mobility managers. That's the organizations, the RCC. There's lead agencies like Nashua Regional Planning Commission, that's a lead agency, and then the transportation providers. And we also coordinate with other state agencies, the Department of Education, DHHS, which is really good if there's issues about Medicaid. We try to get those issues to them so they know. And then there's Medicaid brokers, they try to come to the meetings, in the veteran services, and disability and aging, of course. So go ahead, Janet.
Yeah, I just want to jump in. So the State Coordinating Council was created by RSA, and it is in the law that group will be represented by representatives from all of these various state organizations. This is a major effort in the early 2000s that predates the 2007 legislation to try to bring all the departments that have something to do with transportation, keep moving together. Everyone's got some kind of funding. So DHHS, Health and Human Services has money, Department of Education, Labor, they all have some funds related to people transportation to bring them all together in one group to try to coordinate all the pots of funds, if you will, to better serve the state as a whole.
So it's a whole council, so that we try to all work together. So So this is the blueprint. So this is all the, what they were envisioning, Janet, as well as, the SEC were envisioning for the mobility network, and there's a lot of tasks in there to complete. So, so that's something that's, if you wanted a copy of it, I could send you a copy of it, but it's really forms the basis of this. So this just isn't random standing up here talking about this. It's all planned out. So that's kind of the plan. So. So, and again, mobility management, it's a family of services, and we try to have a community vision where we really try to work for people and get people what they need. And it can be transportation, but it can be other things as well. If you think you need other things too, you could always call. And then there are agencies in the state that will help people. So we try to get that information to people. Oh, okay. So now we're talking, we really came here to talk about this. We could have just went to this and not talk about anything else, but we want to give you a framework of why this is going on. So what's available in Litchfield? So, in Litchfield, there's really two things that, are available. There was just, caregivers, which is a program of Catholic Charities. So if you need services, it is limited to its income. There is an income requirement, and there's also disabled and, an age requirement, and you have to be able to get into a car and not to be, incapacitated. It isn't like incapacitated at all. You have to be able to, move yourself into the car, because a volunteer will come and pick you up. And the volunteers are vetted. And there's information here about, the volunteer driving, which I'll actually pass out in a minute. But this is for people that need services. So if you're, on the lower income of this scale, as well as, you fit the age, or if you're disabled, you should be eligible for it. So, and the thing about this is that, even though they have those requirements, sometimes if you're in a really tough spot, they say that they'll help you out. So it's always worth a call, if you know somebody that you think would qualify for it. So, so it
What
is
will
a
they
good
need
program.
if they call and say they need a ride and they have to register with you? What kind of information do you need to verify their income or their eligibility, or is there a form for that to fill out?
Yes, they have a form and you have to mail the form back to them. So this is not an immediate service,
So
like
you need to plan for this.
you need to plan for this.
It's definitely pre-registration, and they will specifically ask about, and I believe they ask for documentation about income.
Okay.
But it's 62 and over, or, and fitting the lower income category, which I think is 130% of federal poverty level, with a little fluctuation there. I mean, as their executive director has said, somebody really is in need of a ride, they're a couple of bucks close, you know, we're not gonna deny it. But I will deny I said that in public. Okay,
Is there some way that, say, I don't qualify, but I need a ride, is there some way for me to pay for that?
So we'll talk about that.
that's a whole
Yeah.
different ball of
Okay,
wax,
Yeah,
yeah.
we have a transportation directory that you can
Okay,
get, and then
Okay, fine.
there's a lot of good providers on that you could pay. So we have that too for people that can pay. So, but anyway, and the executive director has said that he tries to help people, so.
If I can just back up.
Yeah,
now.
go ahead,
So
yeah.
if you have a younger person who is disabled, all they'll ask for is that it be a physician verified medical disability. So they do ask for that as well.
Those are the criteria, and again, it isn't immediate, you have to register, but then also you have to register for the ride. So there may be somebody available, but there may not be, because it's all volunteer based. So,
And I think they ask you to, I'm pretty sure it's still at 10 days in advance from the ride that you need. So it's, don't call up in the
Yeah,
morning and think
right.
you're gonna get a ride the
Yeah.
next day kind of thing.
call
But
me.
that's the nature of all volunteer driver programs, depending upon how much they rely on technology and computers. Some of them are doing a lot of this still manually by hand and paper and telephone calls, so you have to have that lead time. Others are putting things onto computer that, you know, if you're a volunteer driver, you could look at it tonight and say, I'll take that, you know, ride tomorrow type of thing. So there's some flex, there's some variability across the state too, in the services that are provided.
Right, every organization's a little bit different with as far as the volunteer drivers, like we have one in Mason, and they will take almost anybody. And they also have wheelchair service, so they have different things there where caregivers doesn't have wheelchair service, but we have some options on that. So anyway, so if you do know anybody that's would qualify, or if you think yourself would qualify, please call and register, so you're registered. So and then they say it's a very good service, so. Okay, so
Do you have a copy of what you qualify, how you
Yeah, I do.
qualify?
I do, and I do have, maybe at the end you can make some copies of that if
Sure.
that's not a problem. We'll get you some copies of that.
And if you go to keepnewhampshiremoving.com,
Yeah,
it's all there.
Oh, it's
You
already
can
there.
look up all of these
Oh, okay.
agencies, whether it's be CVTC over in Mason, caregivers. It's all online.
Okay, so, and then this is something that's new to our region, but we did get some generous donations from various places, St. Mary's Bank, Enterprise Bank, the SVTC, and generous donations from individuals to try to get community rides to people. So now, if you know somebody that needs wheelchair service, we do have that ability to provide that. So, so definitely call me if you know people with wheelchair and they can't get where they need to go, or even the rides, like if they need a ride and they can't pay for it from the private directory, we can help them get that as well too. But this is something new, something we just put in, and we're really happy about it because it really covers like Litchfield and Lydenborough that both had no wheelchair service. So, so we do have that now here. Because there were calls from Litchfield for wheelchair, and when we first started, we had nothing. And now St. Mary's gave us the first donation for the wheelchair, and now we're rolling on trying to get more covered with this. And it really makes a big difference to getting people where they need to go. So.
And the
it's very
person
helpful.
does have to live within the region of our 13 towns, and I don't know if you've got
Yeah.
a map of the 13, but
We had it before.
yeah,
Yeah.
she shows.
yeah, of those 13 towns, and again, it's where medical and for a non-emergency medical appointment, it's where the medical insurance is not available to cover that ride. So, I mean, Medicaid does cover non-emergency medical transportation. And we really need to try to use that first before we tap into private funding. Again, trying to use what resources are available in order to stretch those donation dollars out.
Yeah, that's the point, we try to make do with this, but it seems like it's pretty successful as far as like people before they couldn't get with the wheelchair, now they can. And some of the rides we couldn't cover before, but now we can. So it seems like it's going pretty well with this, so it's really been good and really been very helpful. So, but again, you have to email me or call me if you yourself need a ride or somebody you know needs a ride, please do that, don't hesitate. And just keep that brochure because you never know when you might need it.
Okay.
So, and here's something that, if anybody's low income, or even if you have grandchildren that can't afford a bike, you don't know if families are struggling at all, which I think a lot of families are, they can get a voucher. I can give them a voucher for a bike, and then they can get a free bike. Or yourself, if you want to get a bike, you're definitely welcome to do that. And the other thing they do is they take bikes. So if you have old bikes anywhere, and then they refurbish the bikes, and then they give those bikes out to low-income people. So it's really a great program. It really helps a lot of people, especially in the inner city. So many people didn't have anything, like they didn't have for anything, but they had that bike and they could get to work.
Yeah.
So it's really an awesome program. So both, if you know anybody that's in need, have them contact me. Or if you know of bikes that need to be restored, they'll even come and pick up old bikes if anybody wants to get rid of them. So, yeah, if you want to get a bike, it's good. And then they have a bike sale once a year where if you want to purchase a bike, you can buy a bike. They're really good bikes, but they're lower cost than what you would pay on eBay. So, and that keeps the whole organization going, pays all their bills. So, it's just, it's a great organization. So, so good. Good. Oh, then this is something that everybody should sign up for. It's called CommuteSmartNewHampshire.org, and it's there's another W at the front of this. And this is a ride share program, but you should definitely sign up for this. Because if you need a ride, you can put the ride in, and even to the Massachusetts thing. So yesterday, Matt, who I work with, he's the Metropolitan Planning Organization Coordinator. We put in back and forth to Boston, and it came up. So it works for that too. So you could put in that you were going to Boston for a medical appointment, and if there was somebody going at the same time and they put in, then you could potentially ride share together. So, so that's a good program, especially out here where you may not have a ride. You should definitely sign up for that. And then you get rewards, you get discounts, coupons. They try to do things. And if you walk a lot, you can track your walking, or if you bike, you can track your biking. So, but definitely please try to sign up for that, because it's worth your while if you're willing to ride share. So, and you can put in what you like, what you don't like as far as ride sharing. It's a pretty good system. So, but thanks. Oh, okay, so this is, you mentioned about the private transportation directory. So this is, it's a private transportation directory, and it has the public, the community transportation services, as well as private vendors. So there are some private vendors in the area that would come and pick you up and take you someplace. So you could either email me and I can send it to you, or you could go on the NRPC website, or you can go to Keep New Hampshire Moving. And Keep New Hampshire Moving, also there's a description of that on the back of the poster. There's a description of Keep New Hampshire Moving there. So you could go to that too and get if you go to Region 7 in the resources, then you'd get the transportation directory too. And that's a good thing to keep in mind, or even to look at it before you need it. And then you could ask me about what I've heard about various ones. I think they're all reputable on it, but I've heard certain things about certain ones. So like what you're specifically looking for, that could help you. So, so that's something definitely to keep in mind. So. Okay, so then this is about volunteer driving. So I'll pass these out, and it may not be you, but you may know somebody that wants to volunteer, say maybe doesn't have enough to do, or maybe wants to really make a meaningful experience for themselves, and people say they really like it. So, yeah, so here's all the information, and this is the same caregivers that you have one, right?
I have
A million.
a whole bunch of them.
Okay.
I'm giving them out this weekend.
Okay, all right, okay, so good. So anyway, so this is something you should do if you're thinking of volunteering, because it really helps people and there's a big need. I tell people, there might be like newer people around that want to do something, or, people that know the area. Just try to, get them involved in volunteer driving, because it's definitely a good thing to do. So.
Is there a liability insurance that covers the volunteers in case someone's injured when you're transporting them, or is it your own private insurance, or?
I think you have to have your own insurance to cover that.
You have to have your own insurance, but the state of New Hampshire passed a law that it's the Good Samaritan law.
Okay.
Yeah, so you're
Because we
indemnified.
have people, if they fell and they broke something, they'd be suing you as the person that did
Yeah,
it.
again, depending upon the agency you're working with as a volunteer driver, that's a great question to ask them specifically, because some agencies may have a larger umbrella policy. Some of the smaller ones, maybe we're just relying on the state's indemnification policy.
Okay.
But I know that I have a volunteer driver who's fantastic. The guy is fantastic, but unfortunately the agency he was working with closed. And he really wanted to make sure he had somebody with that umbrella policy too. And that's because, he's a very conservative gentleman, and we really appreciate his work. But that's a good question to ask.
So you have to kind of find that out, so.
But again, the baseline is the
Yeah.
state of New Hampshire has a Good Samaritan law.
So So that's definitely something to think about, tell people about it, because it's a big need, and people really like it. The people that volunteer, they really like doing that volunteer driving, because it makes a big difference. So, so this is, overall mobility management. We want to coordinate transportation. We want to provide more services. We're really working hard to do that. So, so we just want to get the word out there, and if you can help us get the word out there to people, that's great as well too. So, so good. Good. Any questions, comments, suggestions, anything? Yeah, go ahead.
Do these services, are we already entitled to these services in Litchfield, or is this something that's in the pipeline?
No, so the community rides, you're entitled to that.
Wow, that's
So,
great to know.
yeah, you're definitely entitled to it. And the reason we kind of did this was to try to get Litchfield and
Yeah.
Leidenborough, because I was getting calls, wheelchairs in Litchfield, and I didn't have anything to say. So, so we got that.
You're eligible for it. This is not an entitlement program like Social Security or
Yes.
Medicare. You're eligible,
But there's-
you're eligible because Litchfield is part of the region.
Okay, thank you. So there's nothing special we have to do to advocate for it, or we just have
No,
to.
no, no,
be
it's,
registered? Yeah.
it's there.
Well, you have to qualify for it.
Well, you're right, you're eligible to start with
Right,
because you
but
live
have
in the
to
town.
Qualify for it.
Mhm.
But
Well,
as an individual, not as a town, you can, you know, because
Right.
we live here, we're eligible for it.
and the eligibility, as you know, we went through is, we're not having age eligibility, we don't have an income eligibility necessarily. You know, it's what kind of ride you need, where do you need to go? If you need to go to California, we might have a problem with that. You know, but we will ask questions, you know, are you a veteran? To see if there's any way to hook you up if you're not aware of, what's available through GAV or New Hampshire Veterans Association. You know, what kind of insurance do you have? Do you need some help negotiating with your Medicare Advantage? Because they, you know that they've got transportation, you just can't get through the right door to get it. Cause some of the Medicare Advantage plans do have
Do you actually
transportation
build a
coverage.
Medicare Advantage plan?
We do not know.
Oh, okay.
We do not. We can help you try to negotiate through that hurdle.
Yeah.
But most folks are getting real savvy about those things these days. But it is a hurdle sometimes, some days. So,
Thank you.
But and we do try to help like the people in the towns. Because that's what we're here for, is to try not to say no to people. Some people, they can pay and they want to pay. They don't want to, you know, take the service from somebody else, but if you think you need it, and then we try to help you. So if you there's just a few things in the pamphlet I just want to call your attention to. If anybody's on Medicaid, or if you know anybody on Medicaid, there is a medical transportation for people on Medicaid. You have to call ahead of time, and you just have to kind of stick with it. If you call them, stick with on the phone, if you do have Medicaid. So then again, there's the Keep New Hampshire Moving site there. There's also taxi service, SNK Taxi here. And then there is you must all know about the Boston Express bus. Do you know about that to get into Boston? And that's pretty good. And so that's exit 8. And there's also one in Londonderry too, which some people here might go to Londonderry
Right.
instead, and that's actually pretty good too. So, so I just wanted to call your attention. Everything's here, and you know, please call me, and please come to our meeting. Or I have a few other things I just want to pass out. So, the AARP has this. If you need to get to the like a library to do some digital work, or if you need to go to a class, this is a voucher. So, so you have to call. This isn't the actual voucher, this is information about the voucher. So you have to call up and then you get a voucher for an Uber ride to get to the library and back, or to get to a class. So they want to help people get information about, you know, digital equity. So then I'm going to pass this out too. This is about SNAP. So I was at a presentation with United Way, and the SNAP in the state isn't being utilized as much as it probably should be. So if you know anybody that would need SNAP or maybe would qualify, please, yes. Yeah. That's the information's all there to sign up for it. because, you might as well, and with the prices of everything being so expensive, you never know when you're qualified. You know, people like in your area might know and know that they need it, so, please have them sign up for that too. So, and then this is just, if you have, this is from the United Way, any laptop, donations, you okay? Laptop donations, I don't know if anybody take it. They are looking for donations, so. So this is how we try to help each other out here, you know, giving out information about various people, about programs.
At the Regional Coordination Council for Community Transportation's table, United Way, Bridges, Swing Valley Rides, Nashua Transit, the statewide mobility manager, the Nashua Soup Kitchens, Hillsborough County Meals on Wheels opportunity. We have a variety of health and human service agencies as well as transportation providers who come and meet with us each month and are working together to improve community transportation. So that's where some of these, you know, what's laptop donations have to do with transportation and rides? We all support each other. So to get the word out.
Exactly, thank you. And the survey's here, if anybody wants to take it, just, you know, the survey for the medical transportation to Boston, you could just take it and fill it out if you want, just leave it in here.
If you do seek medical care in Massachusetts, we really appreciate your feedback on that.
So that's,
Thank you.
When we got started, I don't remember your name, I'm sorry.
Thank you.
Joanne, we were talking about, you know, transportation needs and what's available in Litchfield. And we asked everyone, if you would feel comfortable, could you share your name and email address, contact information in the event that we are able to do more? We'd like to know about people who we can contact within the community. And maybe put you in connection with whoever at town hall we're working with at that time. I know at the last Nashua Regional Planning Commission Commissioners meeting, I was talking with Kim Queenan, one of your selectmen, as well as one of your state reps. And there was interest in looking at what more can be done within the community. So that's the reason for asking. So we'll pass this around. Got you three, and then I will make a copy of this and I will send it to
Okay.
everyone, I promise.
thank you.
You know, on some of these questions, you should utilize them now.
If you don't feel comfortable, don't, but if you do,
Yeah, if you
fill it out.
don't, if you don't.
If you don't feel like it
Yeah,
applies.
Yeah, I don't have the info, don't worry about it.
Yeah, see, years ago, I had, had my lung removed, and my doctor was in Lowell,
Hmm,
so I was at Lowell General Hospital for, you know, x-rays and different things. But there was a doctor from, Mass General that worked at Lowell General once a week.
yeah,
And he was the one that operated on me, but he would only do it in Boston. That's why I ended up in Boston one time.
yeah, and, you know.
But I would
and-
never have gone there if it wasn't for.
And some people I know, even though they may go through the first, you know, first round of evaluation, say at Southern, or I call it Memorial, okay, I'm showing my age here.
Oh.
But over at Southern, but yet, if they wanna have surgery or do follow-up treatment,
Yeah,
they will only do it at Mass General.
yeah,
Or they'll only do it at Brigham and Women's.
yeah.
Again, it's perception, trust, whatever, what you feel comfortable with.
It's also the test of that, because I was always in the operating room every day with the surgeon I worked for, is that you have to have a team that you can depend on.
Yep,
And if you're not performing
Oh,
surgery someplace
true.
every day, your nurses don't know how to take care of you in recovery.
Yeah.
You know, even the radiologists reading x-rays, they've never dealt with before, so that's why they keep their specialties where they know the care is.
Okay.
And they, you know, we haven't come to that level in a lot of places, that's why we have major centers. I mean, when I was doing pediatric heart surgery, there were only 10 children's hospitals in the country that did pediatric heart surgery, that started back in the 80s, now there's more. But you think of all the non-surgical interventions that we've done now. They can do that here because it's not a surgical, thing, and it's not the same kind of recovery you have for what you were doing.
Right.
So it depends on what the backup team is, along with where the surgeon's from.
Oh, exactly, and if you look at it too from a fiscal standpoint, and this whole topic came up at the last RCC meeting. There was like, well, why can't we have this at all the hospitals? Well, it's not feasible, one, because of staff shortaging and the cost. I mean, this is specialty care by professionals who do a volume. And you're just not gonna find it at everyone. That's why we have tertiary and primary care